Friends, let's learn about some practical aspects of publication in ophthalmic journals. I'll be sharing my views from the minimal experience that I have. I'm Dr. Madhurima and I welcome you to this session. So, research involves researching, rereading, and relearning. All 3 points are very important when you go ahead for a publication. So, whenever you think of a publication, you should identify your reason for publication. Why do you want to publish at all? As I see it, there are four possible advantages. One is academic gain, which is the most important one. In the sense, you are learning more, you are achieving some kind of academic gain in, in the form of increased knowledge or wisdom. The second is interest. Some people have this interest of studying or writing or relearning, which helps them to pursue publication. The third most common reason why I see people publishing is professional gain. In the sense, there are some educational bodies which give you incentives in the form of some monetary gain or probably a professional gain that will make you go ahead with publication. And the last is pastime or a hobby. Who can publish? So when I meet people, they say, "You write so much. How is that you can write so much?" Can't I write? I'm not working in a university. I'm not present in a teaching institute. I do not have any experience in publishing, nor have I attended any workshops in publications. So the answer is anyone. All these factors do not matter at all. Anyone can publish. So what are the types of articles that most of the journals accept? So in the order of their weightage, it's review article, original article, case series and case reports. I have kept systematic review and meta-analysis separate because I haven't myself ventured into these and I find them very difficult to understand, let alone write them. So today we'll be mostly concentrating on case reports because most of my friends here are standalone practitioners and they get a variety of beautiful cases which they want to report and they don't have a direction. There are other types of articles in many other journals like image-based questions, clinical pearls, quizzes, letters to editor, and sometimes history page. Now, let's see how we choose a case. It should be a very rare case, otherwise I can't publish it. It should be the first reported case. All these are myths. So, what kind of case can I take to report it? It should add something new to the already existing knowledge about the case. Suppose there is a case for which the clinical features have been described in literature, but today what you saw was something different. Or the investigation that you used to identify the disease was something different and something new, or perhaps something more simpler than what it was, or you have managed it in a beautiful way that you want to showcase. So these are the things that give you an edge over others to publish a case. So what all do you need when you choose a case? You need very good images. You need thorough investigations and consent from the patient, a follow-up and a very good documentation. How do I choose a good journal? Which journal do I send? This is a very frequent question that I'm asked. So I say you look at the author fee if you are a standalone author. If you do not get any compensation from the institute you are going to work, the author fee is very high in many journals, especially if you go for a higher indexed journal. So there are many types of fee that an author can be entitled to. Submission fee is when you are uploading the article. Some journals ask for a fee. Some articles ask for article processing charges. Some articles ask fee only for photographs, and some articles ask money only for open access. If it is not open access, there is no need to pay. So there are many journals with many rules. More importantly, when you are sending your beautiful case to a journal, you look at the indexing. What is indexing? Indexing in simple terms means if somebody looks for your article on internet, it should be visible to them. So there are many agencies which take into account the visibility of your articles. So Scopus, PubMed are the most popular ones, and if your journal is indexed in these two, then you are good to go. That doesn't mean that other indexing agencies do not make your article visible. Your article is still visible on the net, but Scopus and PubMed add a feather to your cap. Then look at the impact factor of the journal and the acceptance rate. If the acceptance rate is 5%, 10%, then you're surely going to be disheartened when you send your first article to that journal. Impact factor or H index is an index that shows that the journal may be popular. In the sense, the number of citations a journal gets per year gives you the H index or the impact factor. The next very important thing in choosing a journal is you be the judge of the journal. You read the current issue of that journal. What is the advantage of this? When you read the current issue of the particular journal that you're interested in, it tells you the type of articles and the level of research that the journal is accepting. If you find that the articles that are published in the journal are not that great, there is a high chance they will accept articles that are not that great. If the articles are really classy and of high standards, then maybe the onus is on you to make your article look very good, and you have to do a very good job with your article. Another important thing that you'll understand by reading the current issue is you'll know when it was last printed or published. If the current issue of a particular journal I'm that interested in was published in 2021, there is no point sending your article there because it will be on hold. Probably the editorial board is a bit lazy and you will be waiting and disheartened with your article. Next is to identify predatory journals. What are predatory journals? Suppose you publish one or two articles on the net. Your article and your name is visible. So there are some journals which kind of find out that you are active in publishing, and then they send you a mail saying, we are so and so, we want your article and we will publish it in 3 days. This is just an example. These journals are not worth publishing, and I advise you to stay away from them. So is there any way in which you can know what journal has what index and what is the quartile of that journal? You can go to the link that I have shown here, and then you can judge yourself what journal you want to choose. So this is how we know about the journal. So I have shown you a screenshot of Indian Journal of Ophthalmology. You can go to the home page of any journal and look at the about the journal, which gives you abstracting and indexing information. So I will be talking a little bit about BMJ case reports because I have got 3 articles in this and I'm very happy about it. It was a lot of hard work, and this is what I summarized from my experience in BMJ case reports. The very good thing about BMJ case report is a Q3 journal, and it has very good journal indices. Acceptance rate is quite high considering its worldwide popularity. It has got a fantastic indexing that your article is always visible when you publish it with BMJ case reports. And if you take the fellowship of 1 year, you can publish as many articles as you want, and they'll never say anything against it. The peer review is of excellent quality, and whatever reviews you get, even if they reject your article, is too good. They are ready to re-review your article once you make the changes and send to them. And what I have heard from others is that even if they reject it and if you plead them through a proper channel, they will reconsider reviewing your article. Their reach is very good, and many countries download BMJ case reports to study. Some problems that I faced with BMJ case reports is the cost of publication is quite high. It is around 37,000 rupees per year. Since I was in an institute, it was borne by the institute, and there is something called as an institutional fellowship. So if you are working in an institution, you can find out from your institution if they have a fellowship like this. They're very crazy about language. They are not because they're British, because they claim that many people download their articles and use Google Translate directly on the article and then read. So if the language is not completely perfect, uh, the Google Translate will give wrong information and the article may convey wrong information. They do not want fancy titles and they're very particular about it. They will send back the article if you make a fancy title. The process is extremely slow. All my articles took 1 year. And they want something different in the article, something different about the case report. It's not something mundane. If it's mundane, they don't publish it. Coming to Indian Journal of Ophthalmology, earlier IJO used to accept case reports as a part of the parent journal. But since this year, they have made a separate journal of IJO case reports. So the good things about this is it has got it is very popular in India. The publication charge is minimal. They charge around 2000 to 5000 rupees per image. IJO case reports is quite quick in publishing, and if you see the current issue, it's very thick. It looks like a textbook. They're not as crazy as BMJ about language, and they have many other types of articles as well. So if you don't want to go on writing about the discussion, if you think, oh, I can't write so much, the discussion may not be so strong, you can opt for image based articles or something else. The only problem in this is it is still not indexed, but there is a word of mouth that uh, they may retrospectively index the articles that are published now. This is the only problem I faced with Indian Journal of Ophthalmology case reports. So I have made a small table for you listing the top ophthalmology journals. So if you see, the fees are quite high and getting through to them is also not easy. The last option here, Digital Journal of Ophthalmology, is a completely ophthalmic digital journal which wants really good quality images, and I'm yet to try one article to be sent to them. So you can even try state journals and look at them if they are indexed, or even if they are not indexed. It's just to give you a start. You can try other specialty journals as well. If your case report is about some neurophthalmic case, you can go ahead in a neurology journal and something like that. You can try other specialty journals. There are a couple of magazines that I have liked. I have published 2 to 3 articles in the iNet magazine, which is a part of American Academy of Ophthalmology. And I want to send some articles to eOphtha, which is quite a common and famous magazine of the Indian students. Review of Optometry is a very nice journal, magazine, sorry, that has very creative titles, and but what I've heard is they only have solicited authors, so we cannot uh, write to them without being solicited. The advantages is these journals or magazines are not peer reviewed. They allow different type of articles and they have a very wide readership. But since it is not indexed or anything, you won't have any professional gain. If you have to represent yourself in the college or in the institute, these magazine publications are not of any use. So now I have chosen a journal, I have chosen a case. Now what do I do next? I would suggest you choose a friend or a co-worker or a mentor who will discuss with you and you can suggest you in your path, because this is the first time you are writing. And then without any hesitation start writing. Don't judge yourself and say, oh, I cannot write. Everybody can publish. So I'll just brief you upon the small steps that you take in writing a case reports. Remember to take baby steps because you don't want to be overwhelmed in a day. Always read the instructions to authors from the website before you begin to write. Many journals have a template. You can download the template and start filling in it to make things easy. So the main headings in any case reports are as I have put it there: abstract, keywords, introduction, case report, discussion, and finally conclusion. At the end of conclusion, we have to give references, and some journals would ask for acknowledgements, financial disclosures. So it depends on what the journals need. Step one, I would always say research first. Before you write, you read. The more you read, the better you write. So this process should begin when you see the patient first time in your clinic. Is this case worth presenting? If so, I have to give him the best care. You practice evidence-based medicine. See what the literature talks about the disease. Document every finding of the disease. Photograph it all possible ways and compare your findings with those in the literature, and then if necessary call your patient back and do the follow-up. Whatever articles you get in the literature, download the whole text. Just don't read the abstract and leave it at that. Read the whole article and store all the articles. They will be helpful in future. Read and underline and store all your articles for future. Now this is the easiest part because we have all presented cases in our post-graduation. You prepare the story, describe the case as you see it, step by step. First clinical history, clinical features, and then investigations and management. Describe visual acuity in 20 by 20 notation because it looks more professional. And prepare the images creatively. Like if there are images of right eye and the left eye, don't send two images. Make them into one, make a collage so that it looks neat and it saves a lot of space also. So try to restrict the number of images to 4. You can max stretch it to 6. If you give more images, then your paper becomes too long and it doesn't look very nice. So many journals require a 300 dots per inch image, so you can convert it using the website that I have shown here. Do not use day-to-day abbreviations like OD, OS, IOP and things like that. Whenever you write abbreviations, expand it and then write abbreviation in the brackets, and then if you can use it subsequently, the abbreviations. Next, you start writing the introduction. When you write the introduction, it should not be too lengthy. restrict it to 300 words. You talk about the disease or drug or whatever the main thing that you're talking about in the case report. Use around 3 to 5 references for introduction only. And at the end of the introduction, it should be hinting towards the case report. Okay. Next, you write about the discussion along with the references side by side. Whenever you are taking some point from the articles that you have read and stored, write down the reference just next to it so that you don't lose it and get tangled in the end. Discussion writing requires a lot of talent and patience. You write an outline first and name your paragraphs as to what you want to fill in it, and then slowly go on filling in it with the help of your downloaded articles. Find out what Vancouver style of referencing is and write references only in that style, unless it is mentioned in some journal. Unless and until mentioned, all journals require Vancouver style. Use new references at least after 2005 or 2010. Unless you have to describe something which was first discovered in 1948 or something like that. The last thing you would want to do is write the abstract. Abstract is a summary. So many of us like to write abstract first because it is the smallest. And when you write the smallest thing, you feel I've done something for the day. But why I'm saying abstract should be written last, because there are a few things that you might derive from your conclusion, or that might have changed when you're writing your case report. So abstract would be best written if you write it at the end. You look again at the instructions to authors and write the abstract. In case reports, usually unstructured abstract is required, in the sense you don't need headings in the abstract like introduction, aims, materials. All those things are not required. You just write 1 or 2 lines of introduction followed by a short case report and 1 line of conclusion. So coming to keywords. Keywords are nothing but words if when typed in Google, it shows up your article. Suppose my article is about anterior uveitis in brimonidine, caused by brimonidine. Suppose. So if I use keywords like brimonidine, keratic precipitates and anterior uveitis, that will show up my article. So these are known as mesh terms. So how do we get mesh terms? You go to the website link that I have shown here, Mesh on Demand. If you type that, you will be directed to this website. Paste your abstract in that box and press search, and you will get the mesh terms. And these terms can be used as keywords. But you should be a little careful because it may give not very some weird kind of names or weird kind of words. Be careful not to use it blindly. So I want to end this talk with a small story about our experience with BMJ case reports. So it was the submission process itself was very irritating because we were not used to that Scholar One manuscripts portal. So getting the manuscript ready was one story. The other bigger story was uploading it onto the system, which took quite a long time for us to understand and to get the hang of it. And we did not get success immediately. Many of our case reports were rejected by the BMJ, and this is a timeline which shows that how long it is taken. So if you see there is a left arrow and there is a right arrow, that means it's taken quite a long time, and one of our articles is still stuck there. It's been a year since we have uploaded it, so it is not an easy task through BMJ case reports. It also depends on how well you have prepared your manuscript. So the latest manuscript that we got accepted was within 3 months, and I'm very happy about it because by now we have got the hang of what these people actually want. So the first manuscript that we sent took around 11 months, and the second one is still there even after 13 months. But the last manuscript, like I said, which we got acceptance, was within 3 months. So once you understand the journal, this journey becomes a little faster.